Hello my loves, welcome back to my channel. Today I have a little bit of a different video for you guys. I am pretty much an hour and some minutes before my first video goes live, so if you have not checked that out, please check it out. I'm looking forward to seeing all the feedback you guys have on the video. If you liked it, if you didn't like it, I'm excited to hear everything you guys have to say. School is about to reopen and I am not ready, but nonetheless, I have to be ready. And I was pretty much cleaning out my clinical bag and I was like, why don't I show you guys what's in my clinical bag? So this is she right here, and pretty much I got her my first semester. I was taking fundamental lab, so this came with everything I needed for that lab and much more, honestly. After that, there was no other use for this bag, so I was like, you know what, I'm gonna just use this as my clinical bag. I also love that it has a zip, mainly because I feel more secure rather than a button to close the bag. I feel like I will have everything and nothing will fall out because of this zip. Let's just hop right into it, why don't we? First thing I'm going to show you guys is my stethoscope. I feel like this is essential to everybody going into nursing school or already in nursing school but don't have one. I know they have disposable stethoscopes, but they're just not the same. So I also got a case for it just so I can protect it against like moisture and anything that can destroy my stethoscope. And this is This is the Littman's Classic 3 stethoscope. It has my earpiece right here and the bell, and I can listen on both sides of the bell. And I just also love the color, mainly because it'll go with my scrubs no matter what color they are. And I also engraved my initials on there. I don't know if you can see it, but if not, then it just has my initials. So, and I love this case mainly because it holds a lot. Like, I have an extra piece for the bell as well as extra earpieces just in case I ever lose them, and batteries for my pen light, which you guys will see a little later on. And on the other corner of this case, I have emergency medication just in case I get a migraine while I'm at my clinical. So I'm gonna put her back, but can we take a moment for how beautiful she is? The next couple of things kind of go hand in hand, so I'm just gonna bring those out together. And it's basically places to write down patient's information. First things first, I think everybody should have a notebook. I think a pocket-sized notebook at that, mainly because again, it'll fit in your pocket and you can just pull it out, scribble your notes, and get on with, you know, your day. As you can tell, I've loved this notebook for several months and I'm definitely using it. And I also have this, which is a mini binder with like mini loose leaf, and that basically goes in my foldable clipboard, and this again can fit in my pocket. And I also love that they have a reference sheets inside of this. I got all of this on Amazon, so I will definitely link them down below. And yeah, so I can just fit papers on here, fit a pen in here, and it'll go in my pocket, ready for me to scribble down anything if I need to. And lastly, I have this H&P notebook, which is basically if you're doing an assessment on a patient, you can write down that information at the designated spots. They have chief complaint, name, date, age, gender, past medical history, past surgical history, labs, a focused exam, physical exam, you name it, it's on here. And this just helps us practice and be better nurses. And I feel like we will eventually have that information in the back of our head, so when we're out in the field, we can do our assessment pretty quickly and actually address our patients' concerns. During my first semester of nursing school, I had a clinical instructor, and she said she definitely recommends us getting these reference cards. So I got this off of Amazon, and it basically has like information that you may need when you're out in the forest, like order of blood draw, basic assessment pain scale, conversions, Glasgow Coma Scale, cranial nerves, stuff like that. and it comes in this little box, and you can also put it on your badge reel too. It just has like a little perforation right there for you to just poke out a hole and put it on your badge. So I think this would be pretty helpful, especially in like med surg where you're like going to be practically one-on-one with a patient and you start getting that experience. Next, I feel like it's very important for you to have a writing utensil. So I have anything from a highlighter to pens to pencils, you name it, I have it. And I have extras just in case I ever lose one, or if somebody in my clinical group needs one. I always have a pen, pencil, highlighter on me no matter what. So I mentioned this earlier in the video, but I carry on a pen light just in case. Now this one obviously needs batteries, and again, I tell you guys, I always keep batteries on me because you never know when you're gonna need it. Just in case I have to do that eye exam, I have my little handy dandy pen light. And then the other things are just like little miscellaneous things that you yourself may need, or me in that case, during a clinical. So I have anything from hair ties to a hair clip to perfume just in case to a portable charger. This is very, very handy, especially if you're like 2 hours away from your clinical site and your phone dies. You have a portable charger on you. I have another hair tie, some mints because you never know. I have not one but two lip glosses. This is the House Labs lip oil, the PhD hybrid in hue. That's both of these are right here. Sunglasses just in case I need it, mainly because I'm not trying to be blind. I have another lip balm. This is the Evio Skin Lip Serum. I have a hand cream. This is also in my last haul. Sanitary pad, alcohol pad, hand sanitizer. This is the Touchland one, and you can see it's well loved. And also my clinical group really used the life out of it last semester. Something else that I will also be bringing on with me, but I won't necessarily put in this bag, is a water bottle. This is the Simple Modern water bottle. It's the 40-ounce one, I think, and I take this everywhere with me. I also have another one with a collapsible spout or mouthpiece. That one specifically I take everywhere with me, mainly because this is like out in the open. I don't want to be infected with anything, so I carry that with me instead. Another thing that I think is really important is a watch. This is my Apple Watch, and I have a regular clock on there, so when you're taking a patient's vitals, you can do 30 seconds on here and then multiply it by 2, and then there you go, you have your respirations, your heart rate. And yeah guys, that's all. Honestly, I don't think I'm missing anything. I may just throw 1-2 snacks in here just in case I get hungry throughout the day while I'm at my clinical site, but that's about it. That's pretty much all I need until I go home. And yeah, if you guys enjoyed this video, please give it a thumbs up. I actually enjoyed creating this video for you guys. I'm trying to think what else you guys may want to see, but this is everything that I have and I carry with me. If you like it, please give it a thumbs up, subscribe to my channel if you are new, and I'll see you in my next video. Bye!